Good morning, everyone, and a very warm welcome to everyone to this very important orientation on Mimic today. So, as you must have seen in our AB-HWC portal, a new provision has been created, which is on Mimic, and Mimic stands for Micro Innovation and Macro Impact. So today we are going to we'll be understanding the entire concept of Mimic, what are the innovations which we can submit under Mimic, and we will also go through the portal requirements, that how our facility staff can upload the innovations so that it can go for further scrutiny. So today we have participation from all the states. We have state nodal officers, we have state consultants of NUHM, as well as state nodal officers of CPHC, and we also have district as well as block official staff from all the states joining us today. So, uh, so I would like to welcome Dr. Balasubramaniam sir, advisor CPHC division, to give an opening remarks for the session. So over to you, sir.
Thank you, Dr. Anwar, and good morning to everybody. Thank you for joining in large numbers. We deem it as a very important event so that each one of you can come onto the same page to understand what this program is all about. As Dr. Anwar has highlighted, MIMIC is an acronym. It stands for Micro Innovations for Macro Impact in CPHC. That means small innovations that you make at the facility level or at the community level, how it can make big impacts both in your program at your facility as well as across the nation. So such innovations that you do at the Ayushman Bharat Health and Wellness Centers is what is being recognized, appreciated, and awarded through this framework. So basically, micro innovations. So there are many things that you people do at each of your own facilities at individual level or as a team, which brings about immense modifications in the way services reach out to the community, especially the vulnerable community. It can have tremendous impact on the levels of patient satisfaction or client satisfaction. It can have an immense impact in terms of the utilization of services. It could also have an immense impact in the overall health of the population that you all serve at the health and wellness center level. So it necessarily means that all these innovations are being carried out at the facility level by the team members, and more important, it actually creates a platform for creating a sort of movement and motivation for all the primary healthcare members to actually indulge in creative actions which could actually help the community at large, and they themselves would get recognized. So the award also will be at the state level as well as at the national level, and each of these awards would be for the facility team. In other words, this is not for the PMU units at the state or the nation or the district. It is more to do with the facility level, where the primary healthcare team members engaging with the community, delivering comprehensive primary healthcare, are able to bring about their creative thoughts and actions impacting health of the communities. That is what is going to be recognized. The second important is this recognition or innovation is not going to remain at your facility and your level. That is what is the major reason why we are talking about macro impact. Some innovation in a state of Kerala or Puducherry can reach up to Manipur or Meghalaya or Ladakh and Jammu. That means to say one CHO or a PHC medical officer or their entire team of ASHAs and ANMs and staff nurses engaging and creating something very new in the process, the way you actually did. For example, you would like to engage all the community members to utilize your services. I was discussing with this team, with our team, and I was saying that how such innovation could also be thought of. We have a life course approach in comprehensive primary healthcare, and you would want to reach out to every segment of the society. So you may say at the facility level at the Ayushman Bharat Health and Wellness Center, you have time slots for appointment for school age children, for elderly group, or home, I would say homemakers, so that they can come only at that time. So you may say 9 o'clock I will have only for school age children, school children, so that they can from home they can come to the facility, address their health issues which could be minor or this month, and then go to the school. They can actually say 12 o'clock I'll have elderly care, so that elderly people could be escorted by the people at home after doing their household chores, bring them to this one. So without absolute more waiting for them, you would have ensured that the elderly people are taken care of leisurely also. So in that way, you would have created convenience by just ensuring a different scheduling of the patients at the facility. I'm just giving an example. This is not a policy. Okay. So even small such innovations, then you will start realizing after 6 months if this has actually helped people to become more satisfied, their waiting time to be substantially reduced sitting at your place. At the same time, it encourages more and more footfalls to your center. That means this small change that you brought out has got tremendous impact in terms of the utilization of the services. So we want to identify such small changes that you have made and allow people from all over the country to recognize that you have made the change, copy your change in their places, so that people in their areas also start engaging, and means so people, primary healthcare teams in those facilities also start adopting it, which makes you, I would say, which will be useful for people in that area also. So like this small innovation in Puducherry might actually could go to Manipur. From Manipur, same time it can go to Ladakh, same time it can go to Gujarat. So automatically everybody will start understanding Puducherry ka ye solution bahut acha hai, and we all can use that, adopt that sort of change. So if you have been able to create that change, then the Puducherry team will automatically get recognized of that facility. So this is the whole purpose of this mimic. So this mimic page has been made in such a way that any innovation that you put is visible to all the people who log in the country. So that means whatever change you make it, you can put it on that, and that can be visible to everybody in the country. And they automatically will say, "Oh, acha hai." Then that also will give you some credit for this one, and awards could also be taking cognizance of some of these elements, and hence those sort of innovations could be recognized at the district level. It can be recognized at the state level, and of course at the national level. And we are going to have committees which have got a representative at the district level, which will have multiple members, not only the policy makers or the implementing nodal officers, but also some community members, some end users, civil society members, so that they will also be able to contribute for the final decision making at the district level. At the state level, there is a committee, and the national level, the committee is already formed. So if based on that, you will have an award. So the entire process of what it is, how it can be adopted by each one of you, how you can actually represent your innovations, how it will be recognized, all these things will be demonstrated by Dr. Neha Singhal and her team. So thank you very much. Look forward to your inputs and your extensive and exhaustive participation in this important movement that we are going to trigger within the country. Thank you.
Yes, so thank you very much, Dr. Balasubramaniam, sir. Sir has very insightfully and very briefly explained the entire concept of mimic, that what all innovations do we need to harness, especially at the facility level, so that they can be recognized and replicated across all the other facilities of other states of the country. So, without further ado, I would now like to invite Dr. Neha Singhal for the presentation on mimic, and we would request questions as well as active participations from everyone. Of course, today we are having a very overwhelming attendance. Almost 1,300 or 1,400 people have joined, and on YouTube, almost 8 to 900 people have joined this orientation. So we would first take questions from state nodal officers, state consultants, and state MIS officers. After that, if the time allows, then we will also be inviting questions from district officials as well as our facility level officials. So over to you, Dr. Neha. So I hope the presentation is visible. If someone from panelist group, any state. Hello.
Yes, sir, it is visible.
Thank you, sir. Thank you, sir. Over to you, Dr.
Thank you, Dr. An, for and Balu sir for setting the tone of today's orientation. Sir has quite done half the job, I would say. He has explained the entire concept. Now we'll delve into the details of what is mimic and what's the process of its implementation. Acha, we could see so there were some messages in the chat box that the audio wasn't very audible. Could somebody confirm with a thumbs up?
Okay, for those who are having audio problems, the same orientation is also being streamed on YouTube, and the link is being shared, so they can also join through YouTube. In case of low bandwidth, the YouTube does support the streaming.
Okay. And since we have been joined about by around like more than 2,000 participants today who are both from English and Hindi speaking states, we'll be giving this presentation in English. I'll be repeating the things in English and Hindi so that everyone can better understand and absorb the orientation today. So let's start with what is mimic, what was, sorry, yeah. Okay, so today's orientation has basically two parts. First is we'll be giving a presentation on Mimic, which would cover the aims and objectives of Mimic, what's the process of implementation, what's the evaluation process for evaluating the different innovations, what are the different innovation categories, and what is the timeline of this entire process, which spans across the entire year. तो हम आज की प्रेजेंटेशन में एम्स ऑब्जेक्टिव्स इसका प्रोसेस इनोवेशंस को इवैल्यूएट करने का तरीका क्या डिफरेंट कैटेगरीज हैं एंड क्या टाइमलाइन है इस पर चर्चा करेंगे पहले एंड सेकेंड पार्ट ऑफ द प्रेजेंटेशन would be a demonstration of this mimic platform on the AB-HWC portal. तो हमारे पोर्टल में ही इसके लिए एक फीचर बनाया गया है उसके ऊपर आपको डेमोन्स्ट्रेट किया जाएगा. So now the question is why mimic initiative? बहुत सारे लोगों के दिमाग में ये सवाल होगा कि देयर इज ऑलरेडी अ नेशनल हेल्थ इनोवेशन पोर्टल जहाँ पे स्टेट सबमिट देयर बेस्ट प्रैक्टिसेस अंडर डिफरेंट कैटेगरीज. वो मिनिस्ट्री में सबमिट करी जाती हैं, फिर इवैल्यूएट होती हैं, हर साल एक बेस्ट प्रैक्टिस सबमिट होता है. तो मिमिक की क्या जरूरत थी अलग से करने के लिए बेस्ट प्रैक्टिसेस एंड इनोवेशंस के लिए? तो जैसे कि आप जानते हैं कि इन द ईयर 2018 आयुष्मान भारत हेल्थ एंड वेलनेस सेंटर प्रोग्राम वाज लॉन्च्ड एंड इट इज अ वेरी क्रिटिकल प्रोग्राम ऑफ द गवर्नमेंट जिसमें ऑलमोस्ट हम कहते हैं कि 2/3 ऑफ द इन्वेस्टमेंट शुड गो इनटू प्राइमरी केयर, बिकॉज ऑफ विच योर बर्डन ऑफ डिजीजेस एड्रेस होंगी, उससे कंट्रीज का जो खर्चा होता है वो कम होता है, आउट ऑफ पॉकेट एक्सपेंडिचर जो होता है वो कम होता है, एंड आपके जो मोर्टेलिटीज है, मॉर्बिडिटीज हैं, वो काफी तेजी से उनमें कमी आती है। तो इसलिए ये हेल्थ एंड वेलनेस सेंटर्स, दीज आर अ वेरी क्रिटिकल कंपोनेंट। एंड ये देखा जाता है कि सर्विस डिलीवरी प्रोवाइड करते करते आर प्राइमरी हेल्थ केयर टीम्स, दे ऑन देयर ओन इनोवेट, इम्प्रोवाइज, बट ये जो इनोवेशंस होते हैं दे रिमेन लिमिटेड टू दोज फैसिलिटीज ओनली। इनको हम आइडेंटिफाई करके कोई दूसरे सेंटर से सीखें, दूसरे डिस्ट्रिक्ट सीखें, दूसरे स्टेट सीखें, ऐसा नहीं हो पाता है। तो वी फेल्ट देयर वाज अ नीड टू क्रिएट अ मैकेनिज्म स्पेशली फॉर ABHWCs, जिसमें कि ये जो इनोवेशंस हैं इनको रिकॉग्नाइज किया जाए और उसको स्केल अप किया जाए, उसको वाइडली डिसेमिनेट किया जाए बाकी ABHWC टीम से, so that they can also learn and adopt them and this can be scaled up. तो पहली चीज ये। दूसरा, इससे हम चाहते हैं कि द मिमिक प्रोग्राम विल ब्रिंग बेनिफिट्स टू कम्युनिटीज, amplifying these innovations which have the potential to create an impact at scale. So जब एक innovation identify करके बहुत सारे सेंटर्स पे इम्प्लीमेंट किया जाएगा तो इसका जो इम्पैक्ट होगा स्केल पे देखने को मिलेगा, इसलिए दिस होल कॉन्सेप्ट ऑफ मिमिक केम अप। What is the aim of MIMIC initiative? To make innovation a community movement among primary healthcare providers at ABHW. तो एक इनोवेशंस की एक लहर जो है हम कहेंगे कम्युनिटीज में लाने के लिए, हमारी ABHWC टीम्स में लाने के लिए इस मिमिक प्रोग्राम का मेन एम है। अब इसके ऑब्जेक्टिव क्या हैं? जैसा कि एम्स में बताया गया, टू रिकॉग्नाइज, एंगेज एंड एम्पलीफाई इनोवेशंस। पहले पहचान हो, उसके साथ एंगेजमेंट हो, एंड फिर इसको एक सेंटर से बढ़ा के काफी सारे सेंटर्स में एम्पलीफाई किया जाए। सेकेंड ऑब्जेक्टिव है मिमिक इनिशिएटिव का, टू इवैल्यूएट एंड अवॉर्ड हाई इम्पैक्ट इनोवेशंस क्रिएटेड बाय अ कम्युनिटी ऑफ प्राइमरी हेल्थ केयर फंक्शनरीज। तो जो हमारी ABHWC टीम मेंबर्स हैं, इन्होंने इनोवेट किया है, ये सबमिट करेंगे, इसको इवैल्यूएट किया जाएगा, आगे आपको बताया जाएगा। 3 टायर्स हैं जिसपे इसको इवैल्यूएट किया जाएगा एंड फाइनली इसको अवॉर्ड किया जाएगा जो सबसे ज्यादा इम्पैक्टफुल इनोवेशंस हैं। तीसरा ऑब्जेक्टिव है मिमिक प्रोग्राम का, टू कैटलाइज स्पिरिट ऑफ इनोवेशंस अमंग ABHWCs। तो हमारी सब ABHWC टीम मेंबर्स में आशाज हैं, CHOs हैं, मेडिकल ऑफिसर्स हैं, स्टाफ नर्सेज, ANMs, MPWs, रोजमर्रा के काम में काफी इनोवेशन अपने करते रहते हैं, बट ये अनआइडेंटिफाइड रह जाते हैं। तो हम चाहते हैं कि एक ये स्पिरिट जो है इनोवेशन का, ये एक मोमेंटम क्रिएट किया जाए, मतलब ये हमारा एक सेकंड नेचर बन जाए कि हम हर चीज में ना इनोवेट कर रहे हैं, हर कोई भी प्रोसेस, कोई भी टास्क है, उसको और कैसे एफिशिएंटली किया जा सकता है, ये स्पिरिट हमारे टीम्स के अंदर आ जाए। ये इसका तीसरा ऑब्जेक्टिव है मिमिक प्रोग्राम का। नाउ व्हाट आर द स्टेप्स ऑफ इम्प्लीमेंटेशन? क्या करना है आप लोगों को? तो सबसे पहले जो ABHWC टीम मेंबर्स हैं, दे विल आइडेंटिफाई द इनोवेशंस एंड बेस्ट प्रैक्टिसेस, एंड ये मैक्सिमम एक साल में 2 इनोवेशंस पर ABHWC किए जा सकते हैं फॉर सबमिशन। सो दैट्स द फर्स्ट स्टेप ऑफ इम्प्लीमेंटेशन। द सेकेंड इज, जब आपने इनोवेशंस आइडेंटिफाई कर लिए हैं तो इनको अपलोड करना है। सो दैट्स द सेकेंड स्टेप, अपलोडिंग ऑफ इनोवेशंस। एंड वेयर डू यू डू दिस? ABHWC पोर्टल में ही एक इसका अलग से पेज बनाया गया है जिसके बारे में अभी आपको ओरिएंटेशन दिया जाएगा। वहां पे हमारे प्राइमरी हेल्थ केयर टीम मेंबर, CHOs, मेडिकल ऑफिसर्स जाके अपलोड करेंगे कि क्या इनोवेशन है और बेस्ट प्रैक्टिस है हमने अपने सेंटर में किया है और हमें लगता है कि ये और बाकी सेंटर्स को भी इससे फायदा होगा। The third step is that submitted innovation will undergo 3-layered evaluation. तो जो submissions होंगे innovation और best practices के, उनका एक 3-layered evaluation होगा, मतलब कि ABHWC टीम ने सबमिट किया, फिर जो डिस्ट्रिक्ट होगा, डिस्ट्रिक्ट में एक कमिटी बनेगी, वो लोग अपने डिस्ट्रिक्ट में से एक पूरे साल में एक इनोवेशन फाइनलाइज करके सबमिट करेंगे। फिर वो इनोवेशन सारे ऐसे जब सब डिस्ट्रिक्ट से आ जाएगा, तब पूरा स्टेट जो है, स्टेट उन इनोवेशंस में से 3 बेस्ट जो इनोवेशंस होंगे उनके यहाँ पे वो सिलेक्ट करके नेशनल लेवल पे सबमिट करेंगे एंड फाइनली नेशनल लेवल पे जो इवैल्यूएशन होगा वो फाइनली पूरे देश भर से जितने भी सेंटर से सबमिशंस आए थे उनमें से 3 बेस्ट प्रैक्टिसेस एंड बेस्ट इनोवेशंस को अवार्ड करेंगे। एंड चौथा प्रोसेस है रिवॉर्ड एंड रिकॉग्निशन। Like I was saying, the 3 best innovations would receive an award and a citation, and जो भी हमारे स्टेट अवार्ड विनर्स होंगे उनको भी एक सर्टिफिकेट मिलेगा। इवैल्यूएशन प्रोसेस भी वही सेम चीज बता रहा है। सबसे पहले ABHWC टीम मेंबर्स पूरे साल में 2 सबमिशंस कर सकते हैं मैक्सिमम पर ईयर पर फैसिलिटी। सेकंड स्टेप में डिस्ट्रिक्ट पे ये शॉर्टलिस्टिंग हो रही है, तो डिस्ट्रिक्ट की जो कमिटी होगी वो सारे सबमिशंस देख रहे हैं और उनमें से एक इनोवेशन पर डिस्ट्रिक्ट सेलेक्ट करके आगे स्टेट लेवल पे सबमिट करेंगे। स्टेट लेवल पे जहाँ पे शॉर्टलिस्टिंग की बात है वो सारे इनोवेशंस इवैल्यूएट करके 3 इनोवेशंस आगे नेशनल लेवल पे भेजेंगे एंड वापस से नेशनल लेवल पे फाइनली एक कमेटी बैठेगी 7 मेंबर्ड कमेटी जिसमें ASMD मैम सर चेयर होंगे। वो फाइनली जो बेस्ट 3 इनोवेशंस होंगे उनको सिलेक्ट करके अवार्ड करेंगे। इज द PPT visible?
Yeah, madam, it's visible.
Yes, visible, ma'am.
So now we'll just briefly talk what is an innovation, क्योंकि सबकी अपनी अलग अलग definitions हो सकती है, तो ये जरूरी है कि ना standardized understanding हो हमारी। So World Health Organization का innovation group defines health innovation as a process to develop new or improved health policies, systems, products and technologies and services and delivery methods that improve people's health with a special focus on the needs of vulnerable population. तो इसमें जैसे हेल्थ पॉलिसीज जहां तक है वो ठीक है, थोड़ा कंट्री और हायर लेवल की बात है, बट यहाँ पे हम उनको इनोवेशंस कहते हैं जो भी आपके इनपुट्स एंड प्रोसेसेस ABHWC टीम मेंबर्स मतलब हमारे CHOs, ANMs, आशा, स्टाफ नर्स, मेडिकल ऑफिसर्स जो डेली अपनी सर्विस डिलीवरी के दौरान क्या ऐसा इनोवेट करें उन प्रोसेसेस में जिससे कि लोगों का जो हेल्थ आउटकम है वो इम्प्रूव हो, और स्पेशली लोगों में भी जो वल्नरेबल पॉपुलेशन है, जो मार्जिनलाइज्ड हैं, फीमेल्स हैं, ओल्डर पॉपुलेशन है हमारी, उनकी हेल्थ को जो इम्प्रूव करे वो इनोवेशन को हम यहाँ पे आइडेंटिफाई करेंगे। अब इनमें डिफरेंट कैटेगरीज हैं, 8 कैटेगरीज हैं जिनके अंडर ये सबमिशंस किए जाएंगे एंड ये जो हमारे जितने भी की इनपुट एरियाज हैं ABHWC के अपग्रेडेशन के लिए, spanning across infrastructure, service delivery, human resource and multi-skilling, expanded medicines and diagnostics, continuum of care, telehealth, linkages with medical colleges, community mobilization and a robust IT system. इन्हीं सारे एरियाज के अराउंड ये इनोवेशन तो हम अभी आगे और डिटेल में देखें। तो सबसे पहली कैटेगरी है एक्सपैंडिंग HR एंड मल्टी। So what all innovations would be considered here? All innovations highlighting the HR cadre beyond ICH norms.
नाम मड़कर मतलब
Please mute करिएगा. Beyond ICHs or introduction of training packages beyond CPHC. इसका ये जस्ट एग्जाम्पल्स हैं हम जो दे रहे हैं, आप लोग तो और बहुत ज्यादा इसमें ना इम्प्रोवाइजेशन करते हैं डेली। इनोवेटिव ट्रेनिंग ऑफ CPHC टीम मेंबर्स एट द फैसिलिटी लेवल, यहाँ पे हमने मल्टी स्किलिंग की बात करी है, तो कैसे और इनोवेटिवली हम टीम को इंगेज करें और उनकी ट्रेनिंग को और कैसे बेहतर किया जा सके। अभी नए सर्विस पैकेजेस हैं जिनके ऊपर ट्रेनिंग चल रही है स्टेट्स में, फील्ड में, तो ये एक तरह का इनोवेशन हो सकता है। ये सिर्फ हमने एक सैंपल दिया है आपको, आप और सोचिए इसको और बेहतर इनोवेशन एंड इम्प्रोवाइजेशन के साथ आइए। सेकेंड कैटेगरी है हमारी एक्सपेंशन ऑफ सर्विसेज। सो व्हाट इज कंसिडर्ड अंडर दीज innovations around provision of services covering all the 12 service packages under the CPHC program. तो फॉर एग्जाम्पल कई कई स्टेट्स में ना एल्डरली पॉपुलेशन के लिए अलग से क्लिनिक्स होते हैं डेजिग्नेटेड, तो वीकली क्लिनिक्स फॉर एल्डरली पॉपुलेशन इन अर्बन एरियाज बाय तेलंगाना। आज सुबह सर बहुत अच्छा एक एग्जाम्पल दे रहे थे कि कैसे ना हमारी पीएचसी टीम मेंबर्स टाइम को इस तरह से ऑर्गेनाइज कर सकते हैं, जैसे सुबह का समय बच्चों के लिए, दोपहर के बाद का समय एल्डरली पॉपुलेशन के लिए, उसके बाद का समय जो भी हमारा सर्विस क्लास है, मतलब 30 to 60 का पॉपुलेशन है। ऐसे हम अपना ओपीडी टाइमिंग्स डिफाइन कर सकते हैं जिससे कि मैक्सिमम उस एज ग्रुप के लोग उस टाइम के दौरान सर्विसेज अवेल करें एंड हमारी फुटफॉल्स वगैरह भी बढ़ेंगी इससे। और जो अभी हम कई बार सुनते हैं ना अर्बन एरियाज में स्पेशली कि लेट नाइट रिक्वायरमेंट होती है ओपीडी की, बट वहाँ पे क्योंकि सेंटर्स के भी लिमिटेड टाइम होते हैं तो इस वजह से काफी बार लोग हेल्थ सर्विसेज अवेल नहीं कर पाते हैं। तो कुछ इस तरह के इनोवेशन। फिर एक बडी मॉडल फॉर ट्रीटमेंट अधेरेंस। तो मान लीजिए कि अगर कोई हाइपरटेंशन का पेशेंट है, वो कुछ ऐसे ही हम ना कपल्स कुछ पार्टनर्स बना दें और वो एक दूसरे के लिए अकाउंटेबल हो टू इंश्योर कि वो कोई भी डायबिटीज या हाइपरटेंशन का ट्रीटमेंट कंटिन्यू करें और अधेयर करें। Then teleconsultation. That's the third category. This involves innovation outlining the outperformance of teleconsultation or introduction of new systems for teleconsultation. For example, you all know that an average of 25 teleconsultations should be conducted at an AB-HWC per month. तो इसको बढ़ाने के लिए हमारी प्राइमरी हेल्थ केयर टीम क्या करे, अवेयरनेस बढ़ाए या कुछ इनोवेटिव तरीके से हमारे जो टेलीकंसल्टेशन के सेशंस हैं वो बढ़े, तो उसके अराउंड जो इनोवेशंस होंगी वो कंसिडर होगी इस तीसरी कैटेगरी के अंडर। The third is financial reform. So all the innovations or best practices highlighting the cost cutting areas or efficiency in the delivery of healthcare services. तो हम सब जानते हैं कि एफिशिएंसी ये कितनी जरूरी होती है, तो जो भी इनोवेशंस कॉस्ट कटिंग मेजर्स, मतलब वही काम जो काम फॉर एग्जांपल 100 रुपए में हो रहा है वो काम और सस्ते में बट उसी सेम क्वालिटी के साथ विदाउट कॉम्प्रोमाइजिंग ऑन द क्वालिटी अगर हम कर पाते हैं तो उस उन इनोवेशंस को भी हम ये फोर्थ कैटेगरी के अंडर कंसिडर करेंगे। The fifth category is of medicines and diagnostics. So all the innovations highlighting practices for availability of medicines or diagnostics or PPP models or supply chain or expansion of EML or EDL are considered here. For example, कई बार हमने देखा है कि फैसिलिटीज में इंडेंटिंग का ना कभी इनोवेटिव तरीका हमारी टीम प्रैक्टिस करती है, तो वो सब इनोवेशंस ड्रग रिफिल के लिए जो भी क्रॉनिक पेशेंट्स हैं क्या कर रहे हैं हम वो कंसिडर किए जाएंगे इस कैटेगरी के अंदर। देन द सिक्स्थ कैटेगरी इज कम्युनिटी मोबिलाइजेशन। तो इनोवेशंस हाइलाइटिंग द मॉडल्स ऑफ कम्युनिटी एंगेजमेंट और पार्टिसिपेशन और पार्टनरशिप्स फॉर हेल्थ प्रमोशन। For example, we have seen that in the state of Kerala, आरोग्य सेना करके कम्युनिटी वॉलंटियर्स बनाए गए हैं जो प्राइमरी हेल्थ केयर टीम के साथ काम करके और डेजिग्नेटेड हाउसहोल्ड उनको हाउसहोल्ड अटैच्ड होते हैं उनके साथ, और वो कैसे रीच जो है सर्विसेज की इम्प्रूव करते हैं, लोगों की एक्सेसिबिलिटी इम्प्रूव करते हैं फॉर अवेलिंग हेल्थ सर्विसेज एट द प्राइमरी हेल्थ केयर सेंटर्स। So that's an example. Then IT. So all innovations of new technologies except teleconsultations are included here. तो हमने देखा कि टेलीकंसल्टेशन ऑलरेडी एक अलग कैटेगरी बनाई हुई है हमने, तो इसके अंदर उसके अलावा जो भी होगा वो कंसिडर किया जाएगा। अब इसका एग्जांपल हो सकता है कि हमारे इतने सारे एप्लीकेशंस वगैरह हैं, उनसे जो भी डेटा आता है हम उसको यूज करते हुए कुछ फैसिलिटी लेवल पे ही एक डैशबोर्ड बनाएं और उसको हम रेगुलरली मॉनिटर करते रहें जिससे हम ट्रैक करें कि हमारी फैसिलिटी का परफॉर्मेंस कैसे चल रहा है। इसी तरह से जो डेटा आता है इतने हमारे पोर्टल्स और एप्लीकेशन से, उससे हम विलेज लेवल प्लान में हेल्प करें। इसके लिए हम हो सकता है ना VHSNC और जैस मेंबर्स के साथ भी कोऑर्डिनेट करें। So that's another example on IT. Last category of innovation is infrastructure development. So all innovations mobilizing additional funds from other sources of for infrastructure development or demonstration of resilient infrastructure to withstand current recurring calamities with minimal maintenance. फॉर एग्जाम्पल वेस्ट बंगाल के अंदर PRI के साथ मिलके उन्होंने हेल्थ फैसिलिटीज का इंफ्रास्ट्रक्चर इम्प्रूव किया था, ये देखा गया था स्पेशली कोविड के दौरान। तो ये एक एग्जाम्पल है जो इनोवेशंस इंफ्रास्ट्रक्चर की कैटेगरी में कंसिडर किए जाएंगे। फिर आफ्टर अंडरस्टैंडिंग द डिफरेंट इनोवेशन कैटेगरीज, इट्स इम्पोर्टेंट व्हाट आर द डिफरेंट इवैल्यूएशन पैरामीटर्स। तो इसमें भी 8 कैटेगरीज हैं। सबसे पहले इम्पैक्ट ऑन बेनिफिशियरी, तो इसमें हम देखेंगे कि इनोवेशन कितने लोगों तक पहुंचा। इसमें 3 सब ग्रुप्स बनाए हैं हमने। पहले क्या less than 200 people, the second category is between 201 to 500 people, and the third category is more than 500 people. So that's first, impact on beneficiaries, कितनी लाइफ तक, कितने लोगों तक ये इनोवेशन पहुंच रहा है इम्प्लीमेंट करके। उसके बाद सेकंड इज okay, so now the second category is addressing vulnerable groups. So we'll be looking at innovations which impact vulnerable or marginalized populations such as children, women, tribal communities, sexual minorities, etc. That's the second parameter. The third is the project budget. So while no extra budget would be given for this, the existing financial allocations under the NHM have to be utilized by the facility team. Usme we'll see if the project costs more than 50,000 or if it costs between 10,000 to 50,000 or if it's less. Then the fourth evaluation parameter is if it's evaluated by an external agency. So when any of the innovations or best practices are evaluated either internally or externally, that improves the weightage of that innovation. So that's another thing that we are looking at. Then the fifth parameter is development period. So what is a development period? It's a period from conceptualization to initialization of this innovation implementation. So if the development period is more than 6 months, or is it between 4 to 6 months, or if it's less than 6 months, that's the different subcategories. Then after development period comes the rollout period. For how long has this innovation been implemented? It has the same categories: more than 6 months, between 4 to 6 months, or less than 4 months. The seventh category is partnerships. If this innovation involved partnership with any of the private organizations or the government, different levels of our system, or any other community platforms. Like we were discussing for infrastructure strengthening, for improving the HR and infrastructure, the HWC teams in Bengal had coordinated, partnered with the PRI. So that's another parameter. Then finally, public review, which is very important. And by public review, we meant जो भी हमारी AB-HWC teams हैं. So if innovation is submitted by one of the centers, after its submission, it would be visible to other primary healthcare team members also. So looking at how the other team members have responded to that innovation and how many of them have adopted, a score would be given to the submitted innovation. Finally, after any of the evaluation undergoes the 3-tier evaluation, what happens? At the national level, the top 3 innovations would be given a citation. And at the state level, the top 3 innovations would be given a certificate of recommendation by the state level committee. Now, lastly, what's the timeline of MIMIC initiative? So this is the first year of implementation of MIMIC, and we are in the month of June. So just starting 9 months है उसमें from April to December onwards, this is the time where all the primary healthcare team members can submit their innovation. So CHOs and MOs can upload innovation with one innovation per district. So per facility, 2 submissions हो सकते हैं, but at district level, finally they'll select one. Then between January to middle of February, all the innovations would undergo shortlisting and they will undergo state level evaluation, with finally 3 innovations being selected at the state level. From February to March, the final evaluation will take place at the national level on the basis of designated parameters by the committees. जो अभी हमने we saw the 8 parameters. Based on that, the national committee will finally select 3 best performing innovations, and all those 3 best performing innovations would be awarded this award on 14th of April, which is the AB-HWC anniversary day, which is celebrated annually with a lot of fervor and vigor by the ministry. So उस event के दौरान ये award दिए जाएंगे. Now, since this is the first year of implementation of Mimic, so we are considering this as a pilot phase. We are already in the month of June. So ये first year pilot की तरह किया जाएगा, and the process and evaluation parameters will be reviewed based on experiences, changes as needed would be incorporated, and फिर next financial year में after the improved program would be implemented. So that's about the orientation on this Mimic initiative. Now I'll invite Dr. Anwar to please give us a demonstration on how the primary healthcare team members can submit their innovations on the AB-HWC portal. Thank you so much. Over to you.
So thank you, Dr. Neha, for explaining the entire concept of mimic on what is actually mimic means, what is the process of uploading the mimic, and what is the evaluation criteria. But as Dr. Neha suggested that this first year is just a pilot period, so we would welcome everyone to start using this portal. We would welcome all the facilities to start even seeing what other facilities have uploaded the mimic proposals, so that they can implement the similar kind of strategies in improving the efficiency of the outcomes at their level as well. And after all the inputs received in this first year of rollout period, we would be again changing this evaluation parameter, so it will be more robustly, let's say, rolled out in the upcoming financial year. So if someone can confirm, is my screen visible? Is my screen
Yeah,
visible?
sir, it is visible. Visible it is.
Okay. So we won't take much of your time now, because the form we have kept it very simple, and so that it's even user friendly and people do not have to waste too much amount of time on uploading the innovations especially. So you must have seen in the portal, in our AB-HWC portal as well as AB-HWC mobile application, there is one new provision has been created, which is by the name of mimic. As you can see here, even the same provision is also available at your in your HWC mobile application. So if, like, let's say I'll start with first uploading of innovation. So जैसा कि even Dr. Bala said कि all the mimic proposals will be visible to everyone. So any facility uploads their mimic proposal, it will be visible to all the facilities of the country, so that they can review the proposal. They can also all the officials can so all the facilities can review each other proposals, and not just review, they can also rate the proposals, because as you would have seen, one of very important parameter of evaluation of mimic award is your public review. And by public review, which means our peer group review. So we would request everyone to go to this page and even look at all the other innovations which has been uploaded by the other facilities. And using the same page, they can also upload the innovation of their respective facility. And as Dr. Neha has said, each year one facility can submit maximum of 2 innovations. So first we would demonstrate how a facility can upload the innovation. So like, let's say I would first say, for example, I belong to this PHC Campbell in Andaman Nicobar Island, and I want to submit an innovation. So what I will do is I'll go and go to this action button which says plus mimic. So you can click that button. So once you click that button, it will redirect you to that web page where you can fill the required information. Then the next is the view button, where all the facilities as well as district officials are able to view the innovations what they have submitted. And apart from it, this is just the basic information of the facilities, which is NIN number, then facility name, facility type, state name, district name, taluka name. This is included so that you are able to sort out your respective facility. You are able to see whatever NIN number you want to see, and you can also make a use of search button. The search button के अंदर आप लोग NIN number डाल सकते हैं. You can also add the name of the facility, and it will give you the search of that respective facility, which for whose mimic you want to either upload or you want to review. So now moving on to the data entry form. So data entry form, there are very minimal parameters. The first parameter is the title of innovation. So you can put up whatever the impactful title of the innovation is, and the maximum characters allowed are 250 characters. If your title is more than 250 characters, it will not allow, because the validation has been kept to maximum of 250 characters. Then the next is like, let's say, for just for demo purpose, I'm just putting test demo as the title of the innovation. The next comes is the category of innovation. So here there are all the 9 categories of innovations which Dr. Neha is explaining in the presentation. Apart from it, it's not just limited to this 9 category of innovations. Like, let's say if some facility does innovations in terms of water supply to the facility. जैसे मेरी फैसिलिटी में पानी नहीं आ रहा था, मैंने ग्राम पंचायत के साथ पार्टनरशिप करके वाटर सप्लाई इंश्योर कराया या इलेक्ट्रिसिटी सप्लाई इंश्योर कराया. You can also include those innovations in the other category if they do not fall in any of the categories which have been mentioned above. So, like, let's say for just for demonstration purpose, I'm doing an innovation on community mobilization on health promotion. So I will just select the category of innovation. Then the next question it asks is specify how many beneficiaries this innovation impact. मतलब को basically we need to say कि our innovation, how many people does it that basically the innovation is impacting, whether they are less than 200 people, whether they are 201 to 500 people, or more than 500 people. So for now demonstration purpose, let's say my innovation is impacting 201 to 500 people. So I'll add that category here. Then next question asks is, does the innovation addresses any vulnerable groups or enhancing any gender equity? So this is just a drop down yes or no button. If I select yes, then a new button will show up which says please select the vulnerable population address. So this is just a checkbox option, and you can select all the vulnerable populations which this particular innovation is addressing. Like let's say for now, my innovation is addressing scheduled caste and sexual minorities and children. So I can select three check boxes. If it's even more, you can keep on selecting. If it's only one, like let's say only children, you can just select children. So it depends on whatever vulnerable population your innovation is impacting. This checkbox option. So like let's say if my innovation is not impacting any of the vulnerable population, because it's more of like let's say infrastructure related innovation, so in those cases I'll just say no. So if you say no, then the categories won't show up. Then the next is when was the innovation conceptualized? When was initially that innovation conceptualized? So this is just a calendar date to select. For example, demonstration purpose, I'm selecting 2nd of May 2022. And when was the innovation implemented? Then when the date for which the actual implementation took place. So, but the one thing to bear in mind is the date of implementation cannot be less than the date of conceptualization, because the validation has been made in this field accordingly. So just for demonstration purpose, let's say my innovation was conceptualized on 2nd March and my implementation took place on 24th of March. So I'll just select 24th of March 2022. The innovation conceptualized and innovation implementation can be same, but innovation implemented cannot be less than innovation the date of innovation conceptualized. Similarly, the next field, what it will ask is whether the innovation is completed or is it still ongoing. So if you select yes, okay, the innovation has been completed, so it will ask for the date of completion. That when was the date completed? If you just select no, it's still ongoing, then the date of completion uh, won't be showing up. Here, there is one more validation that date of completion cannot be less than date of innovation implemented or date of conceptualization. So date of completion should always be greater than whatever date I have put here, which is the date of implementation. Just for demonstration purpose, let's say my innovation got completed on 13th June of 2022. So I'll just select 13th June 2022. Then the next is it will ask the budget range of the project, but as the Dr. Neha suggested, that no separate budget will be allocated for this mimic innovation. But just in case you have allocated additional resources from either from civil society organizations or panchayat bodies and any other partners. So if there is fund involvement, then you can write that range of the budget. If it's not there, then you can just select no. Did you partner with any civil society organization or self-help groups or any other community members to implement the innovation? This is just simple yes or no. If I select yes, then it will ask further two questions, which is whether you are partner for one particular phase or whether you are partner for the entire process. मतलब basically मैंने partnership equity, for example let's say मैंने 6 महीने की innovation की, उसमें मैंने partnership की 2 months के लिए, तो I'll just select partner for the particular phase. But if the partnership is for the entire 6 months of my implementation, then I'll just select partner for the entire process. Just for demonstration purpose, I've just selected partners for the entire project. Then the next is specify the summary of innovation. Here also we have kept an validation of maximum 250 characters. This is very important, especially from the perspective of district and state officials. The reason is why we have kept it so that the evaluation becomes much more easier for the district as well as state officials. So इसमें क्या है, all the facilities, whoever are uploading their innovation, they just need to write a short summary of the innovation, that what is the what is actually your innovation is, then what is the expected and what is the process you followed and what are the outcomes in a short, like let's say around 250 characters. So this summary will help your district officials as well as your state officials in easy evaluation of your innovation. So please make use of this function. and this is mandatory field. Here you have to specify the summary of innovation. Then the next is uploading the document of innovation, and all the documents supported are PDF, JPEG, PNG, or doc files, and maximum size is 10 MB. So this is the validation what we have added. तो इसमें एक रिक्वेस्ट रहेगी कि आप जो भी पीडीएफ फाइल बनाते हैं इनोवेशन का, like the way you put it up, we would request, like as there is a validation of 10 MB, do not add too much pictures in your PDF or doc file, because if you add larger number of pictures, the size of the file automatically increases. So here what we are more interested in seeing is your methodology, your process, and your outcome of your innovation. So you can write it down, and if your size is about 10 MB, you can also make use of online compressors to reduce the size. But if your size is over 10 MB, then this will not the upload of documentation will not be possible. And uploading this document is very important. You need to without that it will not go into the further evaluation. So any innovation you put up, you need to upload the supportive documentation, and supportive documentation you should highlight your title, then the process you followed, what is the methodology you adopted, and what is the impact or outcome of the particular innovation. Then the next is we have also given additional provision of uploading the pictures. So that's why we were saying do not add too much pictures in while uploading in your document, because that will unnecessarily increase the size of your document. Pictures you can upload in the second category, which is upload the pictures, and you can and that is also validated till 5 MB. The picture should be very clear, and it should basically highlight the methodology or the outcome or the impact of your innovation. And here you can upload up to 5 pictures. So if I keep on adding, it will give me another options, like let's say to choose files, and the supported files are JPEG, PNG, and so on. And maximum size is 5 MB. So once I've completed all these entries, as you can see, all the fields are mandatory, so you cannot leave any field blank. So once you have completed all the entries, you can just click on submit button. But for now, I'm not going to submit it, because for demonstration, because for testing purpose, we have already let's say submitted 2 innovations in this respective facility before. So I'll just show you what happens next. Now you can see this. There is one innovation, community mobilization and healthcare innovation, which was already added in this respective facility. So now the district officials as well as state officials, the first district officials will give the score to that respective innovation. So this is more important for now district as well as state officials, because the similar interface will work for state as well as district. So how to score that respective mimic is, you can just click this view button. Once you click the view button, it will show further actions, which is you are also able to, like let's say if you have done wrong entries, you are also, the districts can also edit the respective entries. Like let's say if I've wrongly selected the population or the budget, I can still make the changes until it has been submitted to the state officials. So here I can edit, I can view. If I just click on view button, I'll be able to see that what all facilities have submitted. And the third action button is update mimic score. There is one more button it's not showing here, is select button. This will only show up in the district officials as well as state officials login. Here I've logged in from the administrator, so that's why that button is not showing up. Okay. अब ये this is the scoring page. जैसा कि we have clicked update mimic score. So this is the scoring page, and you can see there are stars here at some places. So these are basically the scores which the district committee and state committee can put it. So specify how many beneficiaries this innovation impact. So we have also put this reference button of scoring, that is one score is for reaching less than 200 people, 2 star is for 201 to 500 people, and 3 star is for more than 500 people. And if there are no people involved, you can just leave blank, so which is automatically 0 score. Like let's say for now, I'll demonstration purpose, I'll just give the score of 1. So I can add a 1 star up to 3 stars max. Does the innovation address vulnerable groups or enhance gender equity? Yes or no? If it's yes, then 1 star. If it's no, then 2 star. And actually, this needs some correction. So it's a maximum of 3 stars. Yes or no? If it's yes, then we will have 3 stars for the same. Specify the budget range of the project. So basically, lesser the budget, more the number of stars. Then development period of the project from conceptualization to initialization of implementation. That the lesser the period, the higher are the stars. Basically, the development period is less than 4 months, then it gets up to 3 stars. If it's less, then if it's more than 6 months, then it only gets 1 star. And if it's very high, then you will give like 0 stars. And the rollout period, that much was the rollout period, the difference between your implementation and your completion. That is your rollout period. So the higher the rollout period, the less the number of you can. And whether you have done partnership with community platforms. So if there is no partnership, then you do not give any stars. If you have partnered for a particular phase, then you can give 2 stars. And if you have partnered for entire process, then you can give up to 3 stars. Has the innovation been evaluated and recommended by the agency? If it's only internal evaluation, then you will give 2 stars. And if it's externally evaluated, you will give 3 stars. And the last is public review of innovation, which we have explained earlier, that this option we will remove it from here, because this will be auto calculated based on the scores which are given by the peer HWC. So for now, as Sir and Dr. Neha has explained, the evaluation criteria is still not finalized, and we'll send the directions about it very soon. So for now, the focus should be uploading the mimic innovation till December 2022, and after that we will move on to this evaluation phase. So I think that's it. That sums up the demonstration of. So once you have updated the score, it will show up in your mimic score here. For now, I have not submitted. That's why it's showing 0. तो यहाँ पे score दिखेगा, और once the district, there is one select button which shows up in the district login. So once you select that, this innovation will go into the state login, and state also can basically select or unselect the specific. So I think that's it for the demonstration. We are now open up to any questions or suggestions. So first we would request questions from the state nodal officers, state consultants, and state NUHM officers. And if there is any state nodal officer or state consultant who is still unable to mute themselves, we would request them to please raise their hand so that we can give them that unmute option.
We had a question in the chat box that whether this would be done at the district level or from the center level, CHO has to do it. So The response is that as we were saying कि the submissions would be done from the facility level. तो जो भी CHOs हैं, medical officers हैं, वो center से submit करेंगे portal में, उसके बाद district level पे इसका evaluation होगा. तो मतलब CHO को submit करना है, to answer your question.
So there is one more question that whether it is applicable for Ayush HWCs. So thank you very much. That is a very valid question. So we'll consult the respective ministry and we'll get back to you on this very shortly.
But you can definitely post this one because evaluation can definitely happen.
Dr. Vaibhav Gupta asked, is there any universal format? As Dr. Anwar was demonstrating on the portal, there is a standardized format जिसमें आपको submit करना है. Those who have questions, we would request them to please raise their hands.
Yeah, with respect to the
National.
I think there is a question regarding who will be the committee members. At the national level, the committee is chaired by the AS and MD NHM. There will be JS policy, there will be ED, NHSRC who will be the member secretary. One public health professional from academia, one public health expert, one member from civil society, and one representative from development partners. So the counterparts at the state level would be the state level committee. So that means your NHM MD would be there, and your deputy secretary would be there, or I would say not deputy secretary, director of health services, and then you have the CPHC team, one public health professional who is independent from the academia, and one public health professional independent who is from the field, means who is actually a professional otherwise, not in the academics. Then we can have a civil society member and any of the development partners who are involved in your state. So that would be the representation there. The district level would have all these representatives, but more important would be that civil society members and end users will also be part of it. So one or two end users from this one who basically civil citizens could also be participating in it. So that will be the committee which actually judges for the score and final selection from the district. So the nominee, as far as the district is concerned, they can have nominations from every facility, but they will finalize one every year and then send it to the state. The state will have at least the number of districts that they have, that is the number of entries that will be finalized, for which the NHM mission director would be actually reviewing it under his his or her chairmanship, and they will be submitting it to the national level. At the national level, we will have about minimum 36 states and union territory submissions, because each will provide one. Okay, and that will give you, we will be able to judge on this. And there will be 3 positions, first, second, and third, in terms of the innovations. Any innovations that have been submitted once and awarded cannot be submitted again. A detailed guidance will also be sent to you. Because all the innovations are expected at the facility level, so none of the judges will be involved in actual implementation or creation of the unit. So the district nodal officer will not be a person who is going to actually indulge in creating an innovation. It is basically from the primary care team member. Yeah, as I said, the peer review is basically by scoring the stars. So whatever marks you give, everybody, any other CHO or medical officer, whoever is logged in from various parts of the country can give this one. Based on that, it auto computes the number of stars. Up to December 31st, you can keep on submitting. But one facility can submit 2 innovations. It could be in the process, it could be in the product, whatever you have done. Okay. Yeah.
We can see that State Nodal Officer NUHM Karnataka.
Good afternoon, Madam and Sir.
So you can yourself.
I have I required a little clarification regarding if
As
suppose.
from Karnataka, we cannot.
Sir, shall I go forward?
Sir, you are not audible.
Oh.
Audible, sir? Sir, I'm audible?
Okay. In the meantime, sir, you are not audible from Karnataka. Maybe there are some connection issues. So for now, we'll move on to Dr. Biswajit.
Sir, good afternoon, Dr. Vishwajit from Odisha SHSRC.
Dr.
So,
Biswajit.
yes, what I find, sir, is really new initiative and the new kind of thought, and it will create a let's say positive competition among different states, and we could able to see different kinds of innovation which could be replicated from one state to another. But the let's say the confusion is, let's say, when we are defining the innovation, so we have given the WHO definition at the very beginning, but you know very well that maybe some innovation, like let's say I am giving you one example which could not be possible to define or to scale to define as an innovation within that particular definition. Let's say I have seen in Gajapati district. Gajapati district, I have seen that to create awareness among the mothers, tribal mothers. So what they are doing, they are giving a specific name by the vaccine. Let's say one mother is called as DPT, another is polio, another is another name of the vaccine, and then that mother on a monthly meeting, she has to speak about that particular vaccine, about its your positive aspects and why we should give it to my child, and what will be the benefits out of that vaccine. And it is a process. It is a process, and it goes on. And then, as a result, all the mothers in the community, they are aware about that vaccination process and what's the benefit of this vaccination. And as a result, they all are. That means the attendance of the beneficiary, that increases. So it is not possible, let's say, within 2-3 months. And what I find, that process takes more time than the let's say impact itself. So that's why I would request, let's say, in the process of evaluation, if we can think in that way, let's say it is not only within 6 months, but maybe beyond 6 months, the time is taken, but impact is huge. So that in that angle also we can consider different innovation. Another thing is, I got one example during the presentation that there was no, let's say, electricity, or there was no connectivity of drinking water, or the potable water facility was not there. So just one CHO, or the community and CHO and the Panchayat Raj, they took the initiative to ensure your drinking water facility or the electricity. That should not be considered as innovation, because it is mandatory requirement, and it is done by the CHO and community together. So my point is that the definition of that innovation should not be within the definition we have given. It is given by WHO. Thank you. Thanks a lot. That's a suggestion only.
The concept is concerned, we exactly echo what we are. Dr. Biswajit, actually, both your comments were extremely valid, and both of it are integral part of the mimic process. a water facility being provided or an electricity being ensured by the panchayat is not an innovation. Okay, so we are not actually looking at that as an innovation, because the innovation has to be in terms of going beyond the responsibilities.
Correct.
So in that context, we are not sticking by the rule, but we are actually going beyond what is the stated responsibility that we have, but we have actually ventured to bring about more, satisfaction at scale. So in
Yes.
that context, I agree with you. The second important thing is the process innovation is the most important thing that we are actually looking for, because facility may not be able to arrive at products. The 6 months period that has been listed is not for conceiving the project or implementing the project, or it is actually visualizing the overall scalability of the project. So in
Okay.
that context, your point of if you have been able to innovate a process of ensuring better immunization, and that immunization has started seeing a trend line which is substantially growing at geometrical progression rather than on a linear fashion, you still stand to gain a lot in terms of getting the award.
Thank you, sir. Thanks a lot.
I think your point would have clarified to all others also. I think it's very important that such sort of creative ventures are recognized.
Thanks a lot, sir.
SPO, any from Karnataka?
Sir, shall I come in?
Yes, sir.
Sir, I'm audible?
Yes, sir.
Sir, I'm consultant from Karnataka. Sir, this is very nice idea that we can learn from others also, where we can find out, local local solutions from the other states and other districts. Sir, I require some clarification is, if suppose some of the districts in Karnataka have got 6 and 7 urban health centers. So if they collectively take an action, innovative ideas or innovative stuff, so how they do entry in this format? If suppose collective
I think
action
we
has
never thought of this collective action, but in the current context of things, if wherever is the idea which has been mooted initially would be the person who would be actually, I would say, entering the data. So because we wanted all primary healthcare team members to actually work on it. So hopefully as days progress, there will be more consortiums and federations working for innovations. But right now the focus is on micro innovations that our team actually PHC people keep making, which goes unrecognized.
Okay, sir. Got it, sir.
Yeah.
Thank you.
Any other questions or suggestions?
Sujit is from Odisha.
Sir, good afternoon. So this is Sushant Naik, Senior Consultant Community Process from the state of Odisha. Sir,
Yeah.
Sir, it's a wonderful thing to happen, because we actually wanted to understand and find out what is happening at the ground level as innovations as well. But so only one concern is that this has to go down to the level of the CHOs as well to understand. It has to be some, because a lot of things which happens at the field level, which usually goes unnoticed, or some kind of structured thought is not been given. So that actually stays unnoticed, because in the state of Odisha also we find a lot of things happening in the field level, but probably CHOs needs to be properly oriented, and probably have to have that kind of lens to see that it is actually an innovation. So this is just only a thought I wanted to share, that these kind of things which is happening at the community level has to be really to be seen properly, and that kind of lens eye has to be with the CHOs and the PSC level as well, so that we can really catch all the innovations. This is just only a thought I wanted to say, sir. Thank you.
Thank you, Sushant. I think I can less agree with you on this element. In fact, the very concept of mimic emerged from that, because we wanted to know, even an ASHA might have done something, ANM might have done something. We want to capture each of those small modifications they have done. The reason why we had to keep it this way is because at a national level, we need to bring about some structures and mechanisms to get it done. We sincerely seek and expect that all the state nodal officers, the state consultants, the district level officers, the district consultants keep educating, supporting, and empowering our primary healthcare team members to start recognizing it. Their own reviews during the field level should help them identify the innovations. That is why a long period is given. Because this is the first year, we have lost 2 months. Otherwise, you will always have time between April and December, which means 9 months of time to recognize your innovation and post it. So we are not saying when you post it, even if you post it on December 31st, it will be still accounted for the year for innovation. So I would sincerely request each of the consultants and the nodal officers at the district level, the block level, at the state level, to keep encouraging our primary healthcare team members to get involved in such innovations, also help them recognize such innovations, and even support them in filling the form whenever there is required, at least this one, so that they will be able to appropriately upload it on time. So this is something that I request all the state people, the state and district people. Thank you.
Okay. Thank you, sir. Thank you.
Yeah, hello, good afternoon, sir. Myself, Dr. Vijay from Odisha, Japaigo team. Sir, I have two things to say. Sir, first is that actually how this peer review will be seen through the portal or through the dashboard actually. Actually, we are not clear about that. So can you highlight on those points? And secondly, sir, actually whether Ayush HWCs will be considered for this mimic or not. Thank you, sir.
So right now, I will tell you about with respect to the peer level. We are only, it is just like when you go to a hotel, you have an option on the Google Sheet to give a star, correct? So, and you can give the number of stars, and the compiled number will automatically, aggregated number of stars keep appearing in front of that hotel to say that this hotel is good or bad. I think that's the exact concept we are also looking at here. So whenever somebody sees it across the nation, if some of our own peer member at a different facility has done something creative, like it, they can put 1 star, 2 stars, 3 stars, whatever they want to put, because maximum is 3 stars. And then depending on how many stars that gets compiled, we have an aggregating formula which will be automated, which will appear as the summated number of the stars in front of that, this one, which is an aggregate of all the peer level, this one. So it is a behind the screen computation for the number of stars, just like how it happens on the Google Sheet for your hotel.
Yeah.
It will be enabled on the portal. That is why everybody innovating on everybody's portal. Anybody logging in will be able to see the whole country.
Thank you, sir. And the second part is that actually whether this Ayush HWCs will be considered for this mimic.
Yeah. See, the Ayush HWCs have been recently onboarded onto the AB-HWC portal. And when the initial concept note moved on, as far as a policy is concerned, it moved through the Ministry of Health and Family Welfare. There is no reason why Ayush HWC team members should be deprived of being creative and being recognized. So we will definitely talk to the Ayush Ministry to institute something for the Ayush also, but that will be a work in progress. So I will not be able to give a decision now, but I can definitely take this input as very important and take it to the ministry for finalization.
Thank you so much, sir, for taking this great initiative. Thank you so much.
Any other comments from anybody else? So please share on the WhatsApp group also if you have anything under the state nodal offices. If you have any inputs, please share so that it will help us. We are running this entire program for year 1 as a pilot only, because at the end of this year's evaluation, we'll be able to understand much better. So the next year Mimic Award process may get modified based on the field experiences that you all bring out. Thank you.
There's also one question in the chat box. What would be the role of block level team member? So I think one of the areas where block level team members can work is they can work with the facility members in identifying the innovations. Like Dr. Sushant was mentioned, that CHOs and medical officers, because they're too much engrossed in the daily service delivery, the islands to identify the innovation and to see that Acha, this is an innovation, this can be submitted as a best practices, is something that is at times difficult. So block level officials, when they visit the facilities on visits, they can definitely work with the team members through observations, and given their experience that they visit so many facilities, they can help them in identifying.
I would say they should, because they are the closest to the PHC team members, and the number of PHCs and the sub-health centers that they will be actually monitoring or mentoring will be much less than what the district can afford to do it. So because you are the I would say closest senior leader for the PHC team, I would urge the block health team members, to block health officials, to proactively engage with your facilities to help them identify, help them propagate, help in propagating the Mimic concept to all of them. I help them onboard on the portal, and even help them identify things where they could copy from other states also.
Hello.
Yeah, please. Yeah, someone else is
Hello.
speaking. Yeah, who is speaking?
मी डॉक्टर फास्के प्रायमरी हेल्थ सेंटर वांद्री महाराष्ट्र.
Yeah, please tell.
Can we submit innovative actions taken for individual patients or beneficiaries?
See, individual patient or beneficiaries, if you have done, if it is only impacting only one individual, you can still submit, but you may not stand a good chance to get the award. However, if, for example, if you have done one thing for an hypertensive patient and it seems to work for every hypertensive patient, then you will stand a substantial, means you will really be in the reckoning for the award.
Okay, thank you, sir.
हेलो सर.
Yeah, who is speaking?
नमस्ते सर, मैं स्वप्निल चौहान बोल रहा हूँ, एक्सटेंशन ऑफिसर हेल्थ, ब्लॉक चिपलून, रत्नागिरी महाराष्ट्र से.
अच्छा.
नमस्ते सर, मैं पहले चंद्रपुर में काम करता था ट्राइबल एरिया में. वहाँ पे मैं एक इंसिडेंट से मुझे कुछ आइडिया है, मैंने प्रोजेक्ट बनाकर डिस्ट्रिक्ट को पेश किया. इंसिडेंट ऐसा था कि 2.6 HB की एक होम डिलीवर्ड मदर थी, तो उसको हमने सेव किया था. उनके रूल के खिलाफ जाके, ट्राइबल का रूल है कि जब डिलीवरी कोई होती है तो उसको गांव के बाहर एक झोपड़ी है, उसमें रख देने का 1.25 महीने तक, 1 महीने से ज्यादा वहां पे रखने का, अलग से आइसोलेट करके. तो हमने उसको बचा के, पुलिस की मदद से बचा के उसको हॉस्पिटल पे शिफ्ट करके अभी वो ठीक है, अच्छी तरह से. तो भी मेरे दिमाग में आइडिया है कि हम आशा क्लिनिक जैसी कंसेप्ट कर सकते हैं क्या. तो इसलिए मैंने वो पीपीटी बना के डिस्ट्रिक्ट को भेज दी थी. वो अभी अप्रूवल पे है, उस पर चर्चा हो रही है. 2 साल पहले की बात है. उसके बाद कोविड आया, इसलिए वो सब रह गया. तो हम इसमें क्या कर सकते कि ट्राइबल कम्युनिटी में आशा क्लिनिक कंसेप्ट डाल के वहां पे उनको सर्विस आशा की तरफ से अच्छी से सर्विस देने के लिए हम क्या कर सकते हैं, इसमें और कुछ कर सकते हैं क्या? मैंने वो पॉइंट भी डाले, क्या क्या कर सकते हैं PR.
No, what I want to clarify to you is, innovation is all about doing. You can do anything. and we don't prevent you from doing anything. We encourage you to do everything. But the only thing that we will be assessing is whether it has got positive impact, and the impact is at great scale. So we are not stopping you from doing, but we are actually encouraging you from being creative.
Yes,
So
sir.
the question whether I should do or not do is a question that you should answer yourself, whether you want to do or not. But we will be very happy if you are doing something and if it has got an impact at scale, which we would like to recognize.
Thank you.
Thank you.
So I think there are no more questions and suggestions, and we would still welcome all the suggestions because this is still in the rollout period. So if there are any more suggestions or you are facing any issues in submitting the innovations, please bring to our notice so that we can modify our this thing entry form accordingly. Up till December, for now, all the states should focus more on uploading the innovations. The evaluation and the rest criteria will be sent to the states and to the districts very shortly. So we are almost coming to the end of our orientation on MIMIC. So I would now like to invite Dr. Balasubramaniam sir, advisor CPHC division, for his closing remarks. So over to you, sir.
Thank you, Dr. Anwar and Dr. Neha and the entire team for taking this elaborate presentation through. And thank you, each one of you, for having participated enthusiastically. Really appreciate your viewpoints, and many of you have positively responded and encouraged this sort of framework. We sincerely hope that this award framework would not only be user-friendly, but also propel a movement amongst our primary healthcare team members to be creative all the time and thinking about how they can serve our communities better and closer to their homes. Thank you.